Well, the first people who will be vaccinated here in the Northern Territory will be healthcare workers, aged care workers and residents, people with a disability and those working in the quarantine system. But when it comes to the general population, the Health Minister, Natasha Fyles, says that indigenous Territorians, particularly those living in remote communities, will be a priority for the government. Here's a bit of what she had to say to me a short time ago.
Just the pure logistics of rolling out these vaccines across the Northern Territory. We have got the urban centres, which are a little easier and a bit more like the East Coast, for example, but some of these remote communities have very small numbers, but they have people that have underlying chronic illness, and so it is a priority for us as a government to get them vaccinated.
Now, one of the problems that the government's facing is how they transport the vaccine to these remote communities. Ash, we know the Northern Territory government's expecting to use both the Pfizer and the AstraZeneca vaccines, but at the moment the AstraZeneca vaccine hasn't been approved by the Therapeutic Goods Administration. Natasha Fyles says the government's looking to transport that Pfizer vaccine to those remote communities, and it's come up with some novel ways to try to get the vaccine there.
We know that the Commonwealth have identified those large freezers to store and have hubs, but the questions are, and we're working through, could we use smaller, using dry ice potentially to get these out to communities. So that's the detail that we're working through, and we will announce that in the coming days and weeks, that finer program of exactly where and when every Territorian will get vaccinated.
This country is going to face some enormous challenges getting everyone vaccinated, Ash, but certainly some unique challenges that we're facing here in the Northern Territory.